Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. I've got here a couple of patients who have loose grommets, or I think they're called ventilation tubes, as standard in the US, that have previously been fitted into the patient's eardrum and have since fallen out, and they're now in situ within the ear canal. So this is patient one, this is their left ear. And you can actually see the grommet here. It's encased with some dry keratin skin. It's in the inferior recess. So just going to be really gentle here. So I don't want to push it onto the eardrum. It can roll like a ball when it's like this. So I've just hovered over with a fine line suction probe, and there you can see the grommet, and it's encased and enveloped with dead skin, keratin. I'm going to look back into the ear. There's some oxidized dead skin posteriorly on the back part of the ear canal wall. I'm going to remove that. And in a moment, after the procedure, I've got a diagram, an image, a still image of the eardrum, and I've annotated it so you can see some of the landmarks there. The patient has also got some dry skin in their right ear, which I quickly removed, and I think I've included that as part of the video. So that's the patient's eardrum, and I will come back to this. I'm going to annotate it for you. And that's the grommet. This particular grommet is known as a Shah grommet, and it's not designed to be in the ear for too long. It can naturally migrate after a few months, typically 6 months. You do get T-tubes, which are more lifelong and permanent grommets or ventilation tubes. So where I've annotated there, that's where the grommet was initially fitted, and it's since healed the eardrum. At the top, you've got a retraction. You can actually see the long process of the incus, and where I am now, that's the chorda tympani, that's the taste, the nerve of taste, the hammer bone, the neck of the malleus. To the left of that, it looks like there's a little hole. It's possibly a pinhole perforation still there, in the attic there, in the top left region. This is the same patient's right ear. So the eardrum looks almost identical. It's still retracted. They've also had a grommet, but this grommet has naturally worked itself out. Now, despite the appearance of both eardrums still being retracted, so buckled inwards due to negative middle ear pressure as a result of a blocked eustachian tube, and I did tympanometry, which is a pressure test. It actually showed that the pressure either side of the eardrum is equal, which is what we want, so the eustachian tube is functioning. Sometimes people just have this appearance after, if they suffer from a retracted eardrum for many years, the eardrum just looks like that all the time. This is patient 2. It's a child, that's their left ear, so again I'm going to annotate that ear for you if you stay tuned. And this is grommet. They also did have a grommet in the other ear, but that, similar to the patient 1, that grommet or ventilation tube had naturally worked itself out. So this grommet is embedded onto the eardrum with some soft wax. They've been using oil, and it just came out easily. It wasn't too much resistance there. Again, the patient still has got glue in. I'm going to annotate that in a moment for you, and you're going to get just a bit of a close-up with the endoscope of the grommet. So you can see a bit of skin there to the left. It's glossy. There's a lot of wax. And that's just it on the tissue, and that's a still image there. You can see how the wax has enveloped itself around the grommet. And I think I've got another still image there. So once more, this patient had a Shah grommet fitted. They will probably need some more grommets inserted because they're still suffering from glue ear. And so you can see there's 2 retractions, one posteriorly, one in the attic, it's at the top. That yellowy appearance behind the eardrum, that's a secretion, that's the fluid, that's glue ear. You can see the neck of the malleus there, and at the bottom, the annulus, that white rim, that's some fibrocartilage tissue, which stretches the eardrum down and gives it its elasticity and its rigidity and mobility. So I just want to quickly explain the function of a grommet. Behind the eardrum, we have the middle ear cavity. That should be air-filled, and importantly, the air pressure behind the eardrum should be equal to the air pressure in the atmosphere. And what regulates the air pressure is the eustachian tube, which is a narrow orifice that connects the middle ear to the back of the nose and nasopharynx. The eustachian tube is typically shut. but during brief moments of yawning, chewing or swallowing, it momentarily opens and it allows either air to enter the middle ear, so it's equal to the atmospheric air pressure, or if there's excessive pressure behind the eardrum, for that to escape. So it's the pressure equalizer. Always eustachian tubes designed to maintain equilibrium of air pressure either side of the eardrum, because when that is the case, that's when the eardrum is most mobile. If that eustachian tube gets blocked at the back of the nose, which is what's happened to me recently, there's no air behind the eardrum, so it's like a vacuum effect. All the cells in the middle ear absorb the remaining air, and as it does, it leaks out fluid from the mucosa into the middle ear. Now that fluid would typically drain out of the eustachian tube, but because that eustachian tube is blocked, that fluid's got nowhere to go, so it builds up, and eventually that fluid will get infected or become viscous, thicker, hence the term glue ear. And what a grommet is, the surgeon pierces the eardrum, it suctions out all the fluid, if there's any fluid in there, the glue ear, and to prevent the fluid from building up again and to allow air to enter the middle ear, because the eustachian tube's out of function, out of action, they insert a ventilation tube known as a grommet in the UK, and it just allows air to enter the middle ear via the ear canal as opposed to up the eustachian tube, because the eustachian tube is blocked. Eventually the grommets can fall out and they naturally migrate out of the ear, and as I mentioned, some people do require lifelong ventilation tubes. They're known as T-tubes in the UK. When you've got a grommet in your ear, you just got to be really, really careful, because if you allow water in your ear, which you shouldn't be getting water in your ear anyway, but more so if you've got a grommet, because if that water enters the middle ear cavity via the grommet, it can cause quite a nasty infection in the middle ear. So people with grommets are going to be really, really careful. And as I said, some people just have to have chronic grommets if they keep falling out. Typically, children are more prone to developing blocked eustachian tubes and glue ear, because the eustachian tube is very, very narrow in the first instance. It's only about 3 or 4 millimetres wide. In children, it's even narrower, and the eustachian tube is more horizontal in position. So it can easily get blocked, especially with children who are prone to getting sniffles and blocked noses. As children age, the eustachian tube can get a bit wider. It becomes a bit more vertical in plane, so the gravity helps fluid drain out. So I hope you enjoyed that video, guys. Take care and speak to you all soon.